Welcome back to this Conversation Matters podcast. And our conversation today is very informative and enlightening. And we will talk about depression in Parkinson's disease because it is often overlooked or undertreated. And about 50% of people will experience the depression, and about 30 to 50 will have anxiety. So it really impacts their quality of life as well as their daily functioning. So this conversation really matters. And so let's get started by welcoming my guest. She is a geriatric and adult psychiatrist, and she was my guest in the past or previous episode 29, which we talk about hallucination and delusion in Parkinson's disease. So let's welcome our guest, Dr. Carolina Osorio. So welcome back.
Thank you so much. I'm so happy to be here.
Yeah, so this time we're going to talk about depression. So, but before we get started, can you introduce yourself for those who may not know you yet?
Absolutely. So I did my psychiatry residency program at Loma Linda University, and then I went to UCLA to do a fellowship in geriatric psychiatry. And I had spent about a decade of my life working with older adults, and a lot of our patients in my clinic, they were patients who were diagnosed with Parkinson's depression and Parkinson's hallucinations and delusions.
So there's a very, how do you say it, like a lot of interactions with those kinds of patients.
Absolutely, yes.
Yeah, so awesome. So for depression, what is depression in general terms? Like to explain it to our audience.
So depression is a illness that can be very severe if not treated on the right time.
Right.
It's usually described as at least 2 weeks of symptoms like lack of interest in things that people used to enjoy before, problems with their sleep, problems with their appetite, constant feelings of sadness, overwhelming feelings of guiltiness, and it can get as bad to the point where people feel that life is not worth living anymore.
Yeah. So what do you think is the cause of depression in Parkinson's disease?
So the cause of of depression in Parkinson's disease is multisystemic.
Yeah.
So number one starts with the disease process itself. In Parkinson's disease, there are the problem has to do with the neurons, which are the brain cells that are affected, and they die and they damage through time. And these neurons are the ones who produce chemicals in our brains like dopamine and serotonin and norepinephrine. These chemicals are important in the way that how we feel and how we perceive the world.
So once those neurons that contains the chemicals, once they start dying, of course they're no longer producing those chemicals. So now these symptoms would manifest.
Correct.
Okay.
And also at the same time, when you suffer from a severe illness that is very disabling, and your life starts to get affected to the point where now you're not able to walk independently or you cannot drive your car, that of course is going to also have an effect on the way how you feel.
Yeah. So are there risk factors that contribute to the development of depression in Parkinson's disease?
Absolutely.
Yeah.
So the disease itself is a risk factor.
Yeah.
Also, other medications can contribute in people with already a medical problem to have worsen or trigger symptoms of depression. Things like isolation, when you start getting sick, you want to isolate, and that becomes like a very bad cycle where isolation worsens depression, but because I'm not feeling well, then I isolate more. Yeah, and then those are some of like the most significant risk factors.
Yeah, and that includes also, like you said, the brain changes, the neurodegenerative. There's kind of like become risk factors too, right? So what are the early signs or symptoms of depressions in Parkinson's disease?
So in general, you are going to see people that they start not enjoying things they used to do. So let's say, I'll just give you an example. I have Parkinson's disease, and I love my grandchildren. I love going to visit them, and now I don't enjoy that anymore. So I stay home by myself. Also, you can see things like your loved one with Parkinson's starts losing a lot of weight. They start being more on the negative thinking. Things are not going to go well. I'm not going to get better. So that kind of negative thoughts is another early sign of depression in people with Parkinson's.
And probably change since the sleep.
Yes,
There's
insomnia is a big one too as well. So appetite, fatigue, sleep, isolation.
Isolations, yeah. And also, I would like to add or mention that in Parkinson's, there is this facial masking where there is the inability to make facial movements like smile or, you know, kind of move your brow. And sometimes that stiffness and facial expressions can be misinterpreted as depression when it is not. It's like just a part of the symptoms of Parkinson's, right?
Yeah, but in general, it's quite the opposite. So people, you know, in Parkinson's, like you say, we call that
The facial masking.
It's a facial masking.
Yeah.
So the symptoms of depression in Parkinson's are the same in people with no Parkinson's, but a lot of the Parkinson's symptoms, they look like depression. So for example, you have someone who's not smiling anymore, and so people would say, oh, that's Parkinson's. But it could be also that the depression is coming in and making those Parkinson's symptoms worse.
Okay.
And so depression that is why we tend to see an underdiagnosis of depression, because we assume are the Parkinson's symptoms.
Right, right. So if let's say if a person sees a patient with Parkinson's and then they interacted with the regular patients or people without Parkinson's, so how will someone differentiate depression from a person with Parkinson's and a person without Parkinson's? Is there
So some of those symptoms are going to be very difficult to differentiate, and even like professional, like doctors like me with a lot of experience can even miss that. There are certain symptoms that are not specific to Parkinson's. So, you know, like not enjoying things, not wanting to be around people, having like more feelings of hopelessness and being constantly irritable when you before were not like that. Those are early warning signs that are not necessarily part of the Parkinson's disease itself.
So depression is treatable. So how do we treat or manage depression?
Absolutely. So there are so many different ways of treating and managing depression. Now we know that, for example, in mild to moderate depression, in any patient, even with Parkinson's or without it, the gold standard treatment is physical activity and cognitive behavioral therapy. So we have lifestyle interventions, we have psychotherapies of different modalities, but also if you suffer from an illness like Parkinson's disease, it is very important that you belong to a support group. So people that are struggling with the same medical problem can understand you, and you can get feedback and recommendations or advice for people who are also living with the same disorder.
And it's nice to interact with a group with, you know, experiencing the same thing, because now you would not feel alone and you would say, okay, there's a lot of us here, you know. I think that's the emotional support that keeps them going too.
Absolutely.
You know. So what do you think is the impact of depression in the overall treatment of Parkinson's disease?
I think this is the most important question, because depression in Parkinson's is a terrible thing to have. We know that depression increases the risk of death in patients with any medical problems. And the reason for that is because when you're depressed, you don't want to engage in treatment, you want to isolate yourself, and it makes your medical problem even worse. So we absolutely have to be very assertive in the way how we treat depression, so the quality of life and the disease progression actually slows down, and your all quality of life improves.
Yeah, because when you withdraw from treatment or you refuse to engage, then that disease process is going to go on and it's going to go downward instead of being arrested and treated, right?
It's a very dangerous slippery slope.
Right. So what should the caregiver or the family member of a patient with Parkinson's do? What should they do if their patient is experiencing depression?
So I think the very first and the most simple thing is to have a discussion with the patient, with the loved one, that you are concerned about things that you're noticing, that things that they're saying, and kind of bring it into their, because sometimes when we're depressed, we don't know we're feeling that way.
Right.
And it is our loved ones or caregivers that start noticing these signs. So if you bring it to the awareness and talk to that person maybe about getting some support or some treatment, then that is a huge step there. But also, when people are very depressed, they're very disengaged, and even if you approach them and you have a conversation, they don't want to accept it.
They don't want to engage.
They don't want to engage. So maybe bring that up to the doctor. It could be the neurologist, it could be the primary care, and see where to take it from there.
Yeah, and the caregivers are very important because they're the first person that notice the subtle change or the early symptoms of depression. So it made me curious. So I read online, and what are the helpful steps or approaches that we could help those suffering from depression? And it says that caregivers can create a supportive emotional environment by helpful approaches like use calm and reassuring communication.
Very important.
Yeah, and then validate feelings like saying, this sounds heavy, but I am with you. You validate the other person. And then avoid minimizing that says like, oh, you'll be fine.
Absolutely, yes.
When they have, oh, I think I have this, oh, you'll be fine. So now your tendency is to ignore it. That's why it's overlooked or undertreated.
Correct.
And another one is offer choices to maintain autonomy. And another is keep routines predictable but flexible, so the patient can have other options.
Yeah.
And another one is encourage small achievable activities, like you said, interact with people, do a small walk, or small conversation. So that is nice. So any resources in the community that the patients or the caregiver can access so they can be helped with their mental health issues?
Yeah, I would say that for patients with Parkinson's, probably the best one will be the Parkinson's Disease Organization, because they do have different resources within their communities for different aspects of the Parkinson's disease.
Yeah, yeah. So is there anything else that you want to share with our audience about depression in Parkinson's disease?
Absolutely. I want to say that if you are feeling down, sad, if you feel like the disease is taking a big part of your life away, do not isolate yourself, reach out, look for help. You're not the only one feeling this way. You're not the only person going through these very difficult times. There is a lot of support there in the community. There is a lot of people that are willing to work with you. And there is a lot of people who are going through the same journeys. And, getting together is going to be such a beneficial and a blessed way to cope with a different situation, like dealing with a disease like Parkinson's.
Right. So thank you so much for sharing your knowledge with us. This conversation really matters. So hopefully Dr. Osorio and I were able to give you a clear understanding of what is depression in Parkinson's disease, and also the challenges faced by the patients, the caregivers, as well as the family members. And don't forget that help is out there. You just have to use it. If you notice anything, symptoms or early signs, just seek professional help. So before we end, I would like to share this quote with you from Maya Angelou. And it says, no matter what happens or how bad it may seem, life goes on and it will be better tomorrow. So thank you so much for watching. Take care of yourselves. Be sure you click the subscribe button, and I'll see you in the next episode. Blessing.